All right, good morning. Thank you for coming to today's nitrogen training. I'm just going to get right into it. So my name is Jacob Reiber. I'm a water resources technician for the Upper Big Blue NRD. And today I'll be talking about water quality in our district. So my job and the job of the NRD is to ensure groundwater quality with three main goals. Goal number one is to use education, research, and management practices and incentives to reduce the potential for non-point source contamination without adversely affecting the local economy. Goal number two is to develop monitoring and evaluation programs to reduce nitrate leaching. And goal number three is to encourage the use of best management practices and the adoption of tools and techniques to reduce nitrate leaching. So in our public water supply, we have 40 non-community systems which serve different people year-round, and we have 39 community systems which serve the same people year-round. Of these systems, we quarterly monitor 37 for nitrates. So this map shows the public water systems throughout our state. The black triangles show where systems are providing treatment for certain contaminants, and the gold stars are where we are quarterly monitoring for nitrates. The quarterly monitoring for nitrates happens when they exceed 5 parts per million for nitrates. And of the 550 public water systems, around 157 are quarterly monitored. And this map shows the administrative orders in effect in our state. So these are when there's certain requirements for specific contaminants. In red is arsenic, green is nitrate, and purple is uranium. So nitrate management concerns arise when nitrates are trending higher over the years. This map shows the median nitrate values throughout our state. As you can see, much of the state is in the green, which is low nitrates, but there are some fairly large clusters of concerningly high nitrates in the red, which is over 20 parts per million nitrates. And taking a closer look at our district, we can see we also have a wide range of nitrates throughout our district, with a lot of green low nitrate values, but also clusters of orange to red high nitrate values. So looking from 1974 to 2019 for statewide median nitrates, we can see the trend line is fairly steep, showing that nitrates have been increasing over the years. And from 2000 to 2019, the trend line isn't quite as steep, but it is still showing an increase over time. So one of the reasons we care so much about nitrates in our water is because they can have adverse health effects on us. Infants below 6 months that drink water containing 10 parts per million or more of nitrates can develop blue baby syndrome, which can cause severe illness and even death if untreated. Other health issues affecting children include pediatric brain cancer and non-Hodgkin lymphoma, which saw a threefold increase in risk, which atrazine and nitrates in a Nebraska study. So Nebraska is 7th in the nation for pediatric cancer and 1st in the nation for certain pediatric brain cancer. And adults can also be affected by high nitrates in the water. It can cause increased heart rate, nausea, abdominal cramps, and headaches. It can also increase the risk of multiple cancers, Alzheimer's, diabetes, and Parkinson's disease. So these are the results for our domestic nitrates for 2024. Of the 245 samples we took, we had a median of 7.22 parts per million and an average of 9.53 parts per million. That average is concerningly high if you take into account that the 10 parts per million is the recommended cutoff for our health. So that 9.53 is dangerously close to exceeding that. So if you have water that is high in nitrates for your drinking water at home, we recommend installing a reverse osmosis filtration system. And if you would like to install that, you can participate in a reverse osmosis cost share that the NRD provides. To be eligible, you have to be connected to a private well, not municipal. You have to have a lab analysis come in at over 10 parts per million, only one filtration system per rural residential parcel, and you have to be in compliance with all Upper Big Blue rules and regulations. The cost share covers 75% up to $500 of the total cost and a minimum of $100. So the three main steps for participating in the RO cost share is bring in a water sample. If it reads in at over 10 parts per million, then you can be eligible and fill out an application and supporting documents. Then once you have the RO system installed, you take in a new water sample, bring it in to be read, a copy of the invoice for the total cost, and photos of the installed filtration system. Some additional information about the RO cost share is your well does not need to be registered to be eligible. You can take your water to any lab to be read, but the NRD does provide water testing for free. And it is for the point of use system, not for the entire household. So other contaminants that can be found in our drinking water that can cause adverse health effects includes arsenic, selenium, and uranium. So we conducted a 3-year study looking at these throughout our district. Arsenic has a max contaminant level of 10 parts per billion. It can cause circulatory damage and skin damage, as well as increase the risk of cancer. So throughout our district, we generally saw levels below that max contaminant level, but there were a few areas exceeding that would pose a risk to your health. Selenium has a max contaminant level of 50 parts per billion. It can cause hair and fingernail loss and circulation problems. Throughout our district, we saw really low nitrate or selenium values, with only a couple approaching that max contaminant level. So based on the samples we took, selenium wasn't very much of a problem in our drinking water. And finally, uranium has a max contaminant level of 30 micrograms per liter. It's toxic to the kidneys and increases the risk of cancer over time. Generally, levels were below that max contaminant level throughout our district, but there were clusters of concerningly high uranium values. It should be noted that these contaminants can be reduced through an RO system, but to be eligible for our cost share, you have to have 10 parts per million of nitrates specifically. So this study sparked 2 main questions. When is the best time to sample for these contaminants, and what well is ideal for these contaminants? So we used our 9 dedicated monitoring wells to try and answer these questions. And this map shows the 9 dedicated monitoring wells in the green dots showing where they are throughout our district. So looking at the results of this study, nitrates, we saw about 4 times higher nitrate values in the shallow depth wells compared to the deep depth wells. And there was a small peak in July. Arsenic saw a different trend with the shallow and deep depth wells following closely together throughout the year, but there was a fairly substantial peak in July and a drop off in September. Selenium looked similar to nitrates, with the shallow depth wells being about twice that of the deep depth wells. And once again, there was a peak in July. And finally, uranium stayed fairly consistent in levels year round. But again, the shallow depth wells was about twice that of the deep depth wells. So some key takeaways is the shallow depth wells generally saw higher levels than the deep depth wells, and the contaminant levels did tend to peak in July and then dip in the September. So these are the results for our summer sampling for 2024 of the 235 sites sampled through zones 1 through 8 and 11. So this year for 2025, we'll be looking at zones 1 through 6 and 9 through 12. And this is a median nitrate value map looking at each zone, and it's color-coded by phase. So the zones that are in gray are phase 1, which is less than 7 parts per million. The zones that are in gold are phase 2, which is greater than or equal to 7 parts per million. And the zones that are in the purple are phase 3, which is greater than or equal to 10 parts per million. So now looking at the results for our median nitrate values for each zone, starting at phase 1 zones. Zone 7 saw a small increase, but generally levels have been stable. And zone 8 saw a small decrease where levels had been on the rise over the years. Zone 9 saw no change over the last 3 years, and that was the same for zone 10 and zone 12, whose levels remain very low. Phase 2 zones, zone 1 saw an increase to this from last year, 9.7 parts per million, and it is approaching that 10 parts per million cutoff. If it exceeds that, then it'll be moved into a phase 3. And zone 2 saw a small decrease this year. Zone 3 saw a small increase this year, and levels have been on the rise recently. And zone 4 saw a fairly substantial increase where levels hadn't changed relatively much over the last 9 years. This year saw a significant bump. And finally, phase 3 levels, zone 5 saw a very large increase, over like 3 parts per million increase this year. And zone 6 and zone 11 saw small increases. So all phase 3 levels, all phase 3 zones saw an increase, and phase 2 also saw an increase, generally speaking. So if you're an operator in phase 3, you must have your water tested for nitrates at least once every 3 years, and you must sample your commingled wells separately. If you can't separately sample them, then you have to let us know. So zone 6 and 11 will be due April 1st of 2025, and zone 5 will be due April 1st of 2026. So you can check the status of your water sample through the Upper Big Blue NRD website at the reporting portal. You can select on the irrigation sample due, and it will tell you your due date. You can use the results of these tests to calculate your pounds of nitrogen available in your water. You can use the chart or the equation found on the reporting sheets or the website to take your water applied in inches by your parts per million nitrates. And then you can calculate your pounds of nitrogen added per acre. So this can help you determine how much nitrogen you want to add so you're not spending too much money on it than necessary and you're not over applying. So if anhydrous ammonia is being applied through November 1st to February 29th, a district-approved nitrification inhibitor must be applied at the manufacturer's rate, and a receipt as proof of purchase must be attached to your phase 2 and 3 report. So some approved nitrification inhibitors include nitroprene, pronitridine, and dicyandamide. Okay, thank you for your time. Are there any questions? All right, well, thank you. And next up is Valerie.
The screen, so we'll see how this works.